97.5 FM, the preferred radio station for the Jewish home.
Hi, this is Dr. Jacques Dweck, and you're on 9.5 Health Watch. And my guest tonight is Dr. Murray Grossan. Dr. Grossan, are you with me?
I sure am. Nice to be here.
Okay. Dr. Grossan is an ear, nose, and throat specialist and otolaryngologist, and he's written a number of books. One of the ones that's of most interest to us right now is Free Yourself from Sinus and Allergy Problems Permanently. And we're going to ask him some questions, and hopefully he'll give us some insights and give our listening audience some help tonight. Again, this is 97.5 Radio Hidda Brut. This is Health Watch. I'm your host, Dr. Jacques Dweck. Our guest tonight is Dr. Murray Grossan. He's been an otolaryngologist, ENT specialist for more than 40 years of experience in ear, nose, and throat. He's seen everything he practices in Los Angeles. He's seen a lot of things, and he has a lot to share with us. Dr. Grossan, could you tell us a little bit about your experience?
Well, you see, I happen to be what's called an advanced scuba diver, and I specialize in scuba diving medicine. And my scuba divers can't take medicine when they dive, because when you're down 100 feet below the ocean, your medicines act entirely differently than they do on the surface. So I've devoted my practice to figuring out ways to get people well without medication. And this is so important because, as you know, today, antibiotics are losing their effectiveness. So we have to go back to how to treat people with chicken soup and tea, lemon, and honey.
Are you serious about that, chicken soup?
I'm very serious because, look, chicken soup happens to have L-theanine, which happens to be very effective in moving the nasal cilia. Tea, especially green or black, happens to have again, L-theanine, which also happens to act to move the nasal cilia. See, most people who have sinus problems, their cilia, the little tiny hairs in the surface of the nose and sinuses, are not moving. Normally, cilia move the bacteria out of your nose, down your throat, into your stomach, where it's inactivated by the stomach acid. And when the cilia don't move, then the bacteria remain in place, they get married, and they have families, and you get sick.
I got it.
What's happening is that people go outside into the cold. Now, the cold air slows the nasal cilia. Then they come back into the school, and they go right into the classroom where everyone's sneezing. If they stop before they go into the classroom or meeting or whatever and let the nose warm up, that'll give the cilia a chance to come back, and then they'll continue to move bacteria out of the nose.
So that's very interesting. So in other words, you have these kids there running into school, and when they run in and they don't give themselves a chance to warm up, they're putting themselves more at risk for catching the infections that are in the classroom and, of course, like you said, in the business place as well.
That's exactly right. When you come into the building, you should take a moment to walk up and down the hallway before you enter the elevator, because in the elevator, of course, that's where the sneezers are. And just that little time allowing your nose to warm up makes a huge difference. Of course, ideally, if you carry some hot tea, lemon, and honey with you, that works even better.
That'll be great.
But see, the reason tea is so effective is the heat also moves the cilia, and the lemon thins the mucus and allows the cilia to move very well. And the honey, of course, kills bacteria. By the way, do you know what my number one cure for allergy is?
What is your number? Dr. Grossan, we're speaking to Dr. Murray Grossan. He is an ear, nose, and throat specialist from L.A., and he's sharing with us some insights. And right now he's going to give us the number one way to help allergies. Let's hear it.
Okay, in allergy, it's what I call you have a crooked thermostat. In other words, instead of your body warming up in the normal manner, you sneeze and hack, which does warm up your body, but it starts a whole cascade. The more you sneeze, the more you sneeze. So the cure for allergy is breakfast in bed. Okay, now, really, this is very serious because a person with allergy cannot handle the temperature changes properly. So when they get out of bed, they start sneezing, and again, the more they sneeze, the more it continues as a cascade during the day. If they drink hot tea before they get out of bed, then the body is warmed up, and they avoid most of the allergy symptoms.
So the earlier in your day that you're drinking your hot tea, the first thing you do in the morning, I know that I go to synagogue early in the morning, and we like to sit in the classroom, and everybody picks up their coffee or their tea, and they're sitting in the classroom with their hot beverage. So we're actually helping treat sinuses, allergies.
Exactly right. You see, when you have an allergy, when you go into an air-conditioned room, you get chilled, and that knocks out your cilia. So in the summertime, I have my allergy patients carry a windbreaker so they can go in and out of air-conditioned buildings, and that really cuts down their symptoms. You see, my goal is to get people to be comfortable and healthy without the fancy pills. And if you have the breakfast in bed, avoid the morning cascade. If you keep yourself from getting chilled during the day, wearing a windbreaker when you need it and so on, you may not need those fancy pills.
You know, it's interesting what you're saying about the getting chilled, because I was always under the impression that you get a cold because of a virus, a bacteria, you're getting some kind of an infection, and you can't get it from the cold. If my mother always used to tell me, put on your coat, you'll catch a cold, put on your coat. I said, Ma, you don't catch a cold like that. You catch a cold from somebody else sneezing at you. But what you're telling me is a great insight.
Well, yes, you see, there are people who work in very cold climates, but they're dressed warmly and they're dressed dryly. In other words, they don't accumulate water in the skin, and they wear a hat and so on. So as long as they don't get wet, because when you get wet, your body cools very, very fast, and that fast cooling is reflected in the nasal cilia. Now, as far as catching a cold, we can prevent people from catching a cold. The answer is smiling. When you smile, your autoimmune system works overtime. And there have been studies done where they had certain group practice smiling during the winter. And they had much fewer colds than other people. Now, some people get very sick when they catch a cold. And for them, we do have a solution. You see, there is a product called ICAM-1. It's a fancy name. You don't have to remember it. But anyway, it's a product that's naturally present inside your nose. And the ICAM-1 happens to be the portal of entry of the cold virus. So for these people, we use my gadget called the Hydropulse, and they irrigate the nose, sinuses, twice a day. They wash out the ICAM-1, and then when they're exposed to the virus has no means of entering the body, and so they do avoid the colds. But this is really just for people who really get very bad, who get bad symptoms when they catch a cold. We don't recommend this for everybody.
Right. So it's interesting. You're talking about this nasal irrigator. It's pretty much like what I recommend to my patients, a water pick.
Well, you see, water pick used to be useful, but there's several problems with that, which we have overcome. Number one, the pressure.
You talk about using a water pick in the nasal cavity?
Yeah.
No, but I'm talking about using a water pick in
For the
dentistry
tooth.
is parallel to your device.
Well, yes. You see, the water pick does pulse at a certain rate, which is ideal for the gums. What we have, the hydropulse, pulses at a rate which is ideal for the nose. And for people who have a bad sinus condition, that is an ideal way of clearing it up because you get the cilia moving, the cilia drain the sinuses, and then you may not need any medication.
Exactly.
Now,
Well, what about the neti pots? How does that work?
Well, unfortunately, what's happened with the neti pot, the University of Pennsylvania did a study, and there's serious flowback, and they found that after 2 weeks, virtually 80 to 90% of all the bottles were contaminated, and people were simply reinfecting themselves. And there's a very famous allergist by the name of Nuzuli who took these patients who'd been sick for like 14, 16 months, took them off of the what we call the flowback irrigators, and 90% of them got well.
Huh.
So unfortunately, it's very easy to reinfect yourself. Now, what's worse is when you blow your nose too hard. You know, you have this big athlete, this big, strong man, and when he blows his nose, you know, you can hear it next door down the street. But he is blowing infected material into his sinuses. So reinfection is very, very important. One of the best things you can do for your children is to teach them not to blow too hard. Both sides open, blow gently. It's when children blow the nose hard that they blow the pus into the ear and get an ear infection.
Wow. We're listening to Dr. Murray Grossan. He's our guest tonight on 97.5 Health Watch, Radio Hiddabrut, and you can listen to us on 97.5 FM, or you can hear us live streaming on www.radiohiddabrut.com. And if you missed tonight's show or you missed part of tonight's show and you want to make it up, you can listen to us on the recorded segments that we keep. But tonight we're live listening to Dr. Murray Grossan. He's an ear, nose, and throat specialist, sharing with us some insights about how to free yourself from sinus and allergy problems and how to prevent getting colds and other very, very nice insights that are very helpful. Dr. Grossan, if you wouldn't mind, I was very interested in what you had to say about the things that a person can do to self-treat themselves when they have sinus problems. So one of them that you had mentioned to me was humming. And I thought that was very interesting. And I had mentioned it to one of my patients this morning, my dental practice. One of my patients was in the chair, and I had mentioned to him, and he said to me, I have a problem with my sinuses, and I actually find that whenever I go for my voice lessons, he goes for voice lessons, I feel much better. So is that a tie-in with the humming? How does that work?
Yeah. Well, you see, remember when you play a piano, when you touch the surface of the piano, you can feel the vibrations. Well, these vibrations are very similar to what your nasal cilia are doing. You know how you can play a violin and have another violin next to it, and the second violin will start vibrating also. So the name of the game is to get those cilia vibrating, because when you have sinus problems, your cilia are not doing their job. If they were doing their job, you wouldn't need treatment. As a matter of fact, one of the things about my hydropulse is that once your nose is normal, you don't need to use it anymore because you don't need to be more normal. But when you hum at a certain frequency, which is if you put your fingers to the side of your nose and go you can feel that vibration. Well, that vibration is pretty much the same frequency that the cilia would pulse at if they were normal. So the more you go, and the lower you go, the more you're getting into that exact frequency, which moves the cilia.
So
and again, go ahead.
These cilia that are in the nasal cavity, which is the inside of your nose, that are in your sinuses, are sort of like little brooms that are sweeping out the bacteria, sweeping them down your throat into your stomach to be destroyed by the stomach acids. Is that the way we explained it?
That's exactly right. You want that stuff in your stomach where it can be detoxified, so to speak. You don't want it staying in your sinuses.
So if I get up in the morning and the first thing I do is I go to my class, I sit down with the rabbi, and I have my cup of hot tea, some honey, lemon, and I start humming in the class. The rabbi may not like it, but I'll be doing a lot of things for my sinuses. Is that right?
But aren't you some davening that you can do with
something like that?
I mean,
something like
just change the pitch.
Exactly.
I think that's very important. And now, in addition to humming, you can also do jumping jacks or jump rope. That also moves those cilia and breaks up the thick mucus.
And it's good for your heart.
Yeah. Now, one of the things that I have a lot of problems with my patients, I try to explain to them about the value of lemon and honey and so on. And they come in with a bottle of water, and I said, why don't you put the lemon into your bottle of water? And it's like a flash, it never occurred to them. So people who have a lot of sinus problems should just simply add lemon or lime to their drinking water.
I could just give you one little qualifier on that. If somebody is having a lot of lemon in their beverages, they should be using a toothpaste that is replacing the calcium into their teeth, because what happens with that constant sipping of acidified liquid, you're having acid in your tea, acid in your drinking water, and you're constantly sipping at it, you are very slowly melting away the enamel surface of your teeth. The solution to that is to use a toothpaste that has a calcium replacement in it. For example, you can use MI paste as a separate paste. They use that. They rub it onto the teeth. Or you can use one of the toothpastes like ClinPro or Pro Enamel. There's a few different toothpastes that are made to rebuild the calcium. So that's just a little side information for those that are using the acid of lemon or lime in their drinking water, in their tea on a regular basis and sipping it slowly. That's what I would advise them as a dentist.
Yeah, well, you beat me to it. I was just about to bring that out because one of my patients has ringing in the ears called tinnitus, and he claims that by chewing lemon or lime, it helps his tinnitus. So I've asked a bunch of people to try this, and occasionally somebody says it does work. But again, you have to explain to them about the effect on the teeth. Very, very important.
Exactly. So, again, we're listening to Dr. Murray Grossan. He's an ear, nose, and throat specialist. You're on 97.5 FM, Radio Hit.Brut. This is Health Watch. We're here every Monday night from 8 o'clock till about 8:45. Tonight we're listening to Dr. Grossan trying to help us cure our sinusitis and prevent colds and address all our nasal issues. If you continue, Doctor, what other advice do you have? So we had two things. We want to keep our nose warm, either with tea or make sure you warm up the nose before you go into your classroom or into your place of business, wherever you're going. We try to do a little humming, but not to be obnoxious about it. And what else? What other advice do we have for people to help prevent sinus issues or at least improve their sinus conditions?
Well, actually, the number one thing is also good sleep. In other words, we have a sleep clock, and the chemical that's involved with that is called melatonin. So if you go to sleep at one day 8 o'clock, next day 10 o'clock, next day midnight, and so on, then you do not set your sleep clock. But if you go to bed at a regular time, say 10 o'clock, and make a very strict ritual of it, wash your face, comb your hair, brush your teeth, the more formal you make this, and the more exact going to sleep at 10 o'clock every night, the better sleep you'll have. The better sleep you have, the better immunity you have to almost any illness. So that is just as important as the other things we talked about.
Beautiful. So
yeah. Now, how do you get to sleep? Well, we have people who have real problems with either pain or because they have ringing in the ears, and for them, I have them watch the shopping channel if they're male, and the sports channel if they're female. Why the sport? Why the shopping channel? Well, A, you're not really that interested in it. B, it's kind of boring. C, you don't really pay attention to it, and also none of that has ever kept a man awake. Same for the sports channel. Now, I'm not being sexist, by the way. It's just that this is what works for my patients.
I got it. Beautiful. So we talked about helping cure sinusitis, preventing colds, mentioned a little bit about how children should not blow their nose, which is to blow very hard, and trying to keep both nostrils open when they blow and to not blow so hard so that they don't blow the bacteria into their ears, which is very important.
Now, you're a dentist. I think you've heard of TMJ.
Sure.
I'm kidding. I don't know about New York, but in Los Angeles, we do see a lot of people who come into my office and they say, I have an earache. I saw another doctor. He looked at my ears. He said my ears were fine, but my ears hurt. So the first thing I do is I ask them to open their mouth. And guess what? Instead of the jaw opening in the midline, they open way, way to the side. And then when I put my finger in front of their ear and ask them to chew, they say, ow, that hurts. And that's what we call temporomandibular joint dysfunction. And the thing about that is that it's so easy to treat and prevent in some patients. I don't know if your listeners have a mirror handy. If they do, they can look in a mirror, open the mouth wide, and see if they open the mouth to the midline or to the side. So if they open to the side, that means that their muscles and their bite is off balance. So what we have my patients do is draw a straight vertical line on the mirror and practice opening the mouth so that it opens exactly in the midline. Now, that'll balance the muscles. If that doesn't work, then, of course, the dentist needs to balance the bite. But the real problem is that we see people who've had the finest orthodonture, and they have the worst TMJ. It's because they've gotten in the habit of biting down, grinding their teeth, and so on when they're in stress. So what we do is we cure them of stress.
That would be nice, but it sounds easier said than done, especially if you live in New York. You know, we don't have that wonderful climate that you have in California.
Well, actually, you can get people free of stress. You see, when you're in stress, you breathe rapidly. So learn to breathe in at the count of 4 and out at the count of 6. That way your exhaling is longer than your inhaling. And that sends a signal to your stress center that there ain't no tiger, and you reduce your stress chemicals. I mean, you still have the landlord banging on your door, but at least you don't produce the stress chemicals. Another thing about stress is that you tighten your muscles. You get ready to flee or fight. So if you look in the mirror and see your face relax, your jaw relax, your shoulders relax, then that sends a signal to your stress center that there ain't no tiger. And
so you're saying by looking in the mirror at yourself, getting more relaxed by this controlled breathing of breathing in 4 counts and breathing out 6 counts, what's going to happen is you're going to see that you're more relaxed looking, and you're going to feel even more relaxed.
Exactly. Now, if you have a lot of money, you can drive downtown to the biofeedback clinic, and they will put sensors on your muscles and show you how to relax your muscles looking at the output of the sensors. If you don't have a lot of money and don't like to park, then you can use the mirror and see your face relax, your jaw relax, and your shoulders relax. Most of my patients prefer not to drive downtown.
So you had also mentioned to me something about snoring. It happens to be last week we listened to Dr. Karopian and his invention of the full breath appliance for treating snoring. But you mentioned that there are some things that people can do, self-help, if they don't get around to making this full breath appliance.
Yes. Well, again, we want to. There is no single method for snoring that applies to everyone. For example, people who have a chronic sinus problem, obviously you have to take care of that in order to get rid of snoring. You know, when you have a cold, you snore. So for those people, using my gadget, the HydroPulse, to clear the sinus is very useful. Now, for people who snore, especially if they're somewhat overweight, if you look in the throat, you'll notice that the uvula, the guy that hangs down the back, is kind of fleshy and thick. And you'll also notice that the muscles are somewhat flabby. In other words, you know how some people have flabby arms, you know, that the skin just hangs down and so on. So in order to clear that up, you want to exercise those muscles. And one of the things we do, we attach a throat device to the HydroPulse. So when you a pulsatile stream, a stream that pulses, it strikes the side of the throat and goes around and, you know, keeps vibrating and hits the other side. And so that will shrink the extra tissue of the throat and reduce the snoring. Other things that work are throat exercises. For example, take your tongue and reach the top of your hard palate. Now, when you do that, try to say A-E-I-O-U with your tongue touching your hard palate. That is a very good way of strengthening the muscles of your throat. By the way, most of this is on my website, which is www.grossaninstitute.com.
And that's spelled Grossan Institute, grossaninstitute.com.
.com, yeah. And then other exercises are, of course, humming at a low tone is also helpful for the throat. There's a gadget called the didgeridoo. It's an Australian horn, and it's a great big thing that goes Well, it takes a lot of force to blow it, but they've done experiments, and for a lot of people, after 6 months of practicing the didgeridoo, not only was their snoring improved, but their sleep apnea actually improved.
So I don't understand. How does this device work?
Well, it's a horn from Australia. It's kind of big. They're about $89 on the internet, and what you do, you have to use a lot of force to blow into it.
Aha.
And so when you do that, you strengthen your throat muscles, and that has really helped a great number of people. Now, most of your speech therapists and your singing teachers also teach you these exercises because you want the throat to be strong and so on when you sing and get the right vibration. So many singing teachers will stress these same exercises Now, I mentioned putting your tongue to the top of your roof of your mouth and doing AEIOU. You can also push your tongue against your upper tooth, your front upper teeth, and try those exercises, AEIOU. And that also does a great deal to help the throat muscles get stronger and avoid the snoring.
We're listening to Dr. Murray Grossan. He's an ear, nose, and throat specialist. I'm your host, Dr. Jacques Dweck. This is 97.5 Health Watch on Radio Hit Brut, and we welcome you to join us every Monday night at 8 o'clock. And we're continuing our interview tonight. We have another 10 minutes left in our interview with Dr. Grossan, and he's giving us some beautiful insights in things that we can do to self-treat sinuses, prevent colds, prevent infections, and also treating snoring. That's a self-treatment for snoring. I'm going to get one of those things. It sounds like a big Australian shofar. So,
right. Well, you know, in a way, it is like a shofar. I don't think people have had scientific studies about that, but I don't see why that shouldn't work also. Now, for $1, you can also cure your sinus, your snoring.
How's that?
It'll cost you $1.
Go ahead.
Well, you get this quarter-inch medical-grade tape, and you tape the bottom of your nose and onto the bridge of your nose and lift the tip of your nose up. Now, in other words, if you take your finger and just gently lift the tip of your nose, you'll notice that you breathe much better because there's a valve, and the lower your tip of your nose is, the more you snore.
Huh.
So by lifting that tip up and keeping it up with tape at night when you go to sleep, that cures a lot of people from snoring and from sinus problems.
Wow. So we're getting some very nice insights in things that we can do to self-help ourselves with sinuses and preventing snoring, and even a little TMJ. You're even encroaching on my field, Dr. Grossan.
Well, as I say, they come into my office complaining of an earache, and it turns out to be the TMJ. One of the things I have in my book that I encourage people to take a look at, the book Free Yourself from Sinus and Allergy, is a method of clearing a child's sinus problems without drugs. There's pictures there, and it shows you how you can lay the kid's head back, put saline on both sides, and with a $2 nasal suction device, you can suction out the sinuses very effectively. And this can prevent a lot of sinus problems in children.
So what you're doing is you're placing some saline in there and then suctioning it out?
Exactly. It's called a PRETZ, P-R-O-E-T-Z, method of sinus irrigation. And basically, my hydropulse is the reverse, is developed because of the PRETZ method. In other words, with the PRETZ method, you put your head way, way back and down. With my method, you lean over the sink, which is a lot easier to do. But for children that under 5, it's pretty hard for a child under 5 to use the hydropulse. This other method works very nicely.
That sounds great.
And it's the method that was used before we had antibiotics. And unfortunately, as the antibiotics get weaker, we sort of have to go back to these methods more and more. Incidentally, I have a thing called ZAP antibiotic abuse personally. If everyone listening will talk to their friends and family and so on, not to abuse antibiotics. If you get a prescription for antibiotics, use it up. Don't take 5, you feel better, and then take another 5 when you feel lousy a couple of months later. That trains the bacteria to be stronger. And if you encourage your friends and neighbors not to ask for an antibiotic unless the doctor, prescribes it, what happens today, the patient comes in and demands an antibiotic. You don't give it to him, and he goes to see your friend next door until he finds somebody to give him the antibiotic. even though the doctor knows that the antibiotic is not a good idea.
Well, you know that in dentistry, we used to pre-medicate people with heart murmurs. And the American Heart Association reversed their recommendation because people were getting allergic reactions to the antibiotic or creating resistant strains to the antibiotic, as you're mentioning. So they actually reversed their whole recommendations of pre-medicating, of taking antibiotics before dental visits. They say unless they have certain specific conditions, they don't take the pre-medication anymore.
By the way, which pre-medication do you prefer for those people?
Well, you're talking about as far as amoxicillin or?
Yeah.
I mean, usually we give them amoxicillin 2,000 milligrams an hour before, and it's one dosage. We used to have that whole extended
I think,
dosage.
as you know, certain people do have to have this because...
right, for example, if they have a heart valve or artificial joints that were recently placed.
Exactly.
So there are times when they must have the antibiotic because there's high risk. But for people that have a simple heart murmur, which years ago we used to pre-medicate everybody with a heart murmur, today we're not because we are concerned about antibiotics and the damage that they can do.
Incidentally, another way of raising one's immune system is eating yogurt or probiotics. The current science indicates that yogurt and probiotics do have an important factor to play in your natural resistance. And if you're taking an antibiotic, we think that you have to stay on yogurt for 3 months afterwards in order to replace the good bacteria that are knocked off by the antibiotic.
Sure. I know that sometimes we prescribe antibiotics that are so strong that you can give people colitis from those antibiotics, such as clindamycin. There are definitely a lot of things that happen with antibiotics, and I love the idea of the probiotics to replace the bacteria that we're knocking out that are the good bacteria that belong in our system.
Well, you know, if I tell someone to take yogurt for 3 months after the antibiotic, there's always a danger he's going to take 1 teaspoon. So I tell him, you have to eat 75 cents worth every day. They look at me, well, what do you mean by 75 cents worth? It has to be 75 cents worth. So that way I'm sure that they're not going to end up with just 1 teaspoon. It's the same thing when I tell them to drink 8 glasses of tea, lemon, and honey. I say it's a glass, not a cup. It has to be a glass, as in 8 ounces. Right. Otherwise, we don't get the results we want.
So let's recap our recommendations to the people in terms of how to prevent or how to self-treat the sinus situation. We mentioned one of the things is as early in the day as possible to have some hot tea and warm up the sinuses. If you're going indoors, if you've been outside where your nose has been cold, and now you go into a building, before you go right into a room where there's many people, let your nasal sinuses warm up a little bit so that they can do their job, and then they'll be able to fight the bacteria and the viruses that are going to be assaulting them as they walk into the room of people. And we mentioned another thing was the humming. I like the humming. I like humming. I hum a lot. Now I'm going to hum more. And and of course, get a good night's sleep. Something very important because your immune system needs that replenishment every night. And without a good night's sleep, your immune system can't do what it's supposed to do when it comes to fighting infection and dealing with the hardships of the body. And anything else, Dr. Grossan, that we can recap for them at this wind down?
You see, I belong to a 5-person ENT group, and we sort of specialize in super-duper sinus surgery. But we have all our patients that are referred to us use the hydropulse to get their sinuses cleared up, if possible, by the pulsatile irrigation. And we're happy to say that half of the patients that are referred to us by other doctors to have surgery, they don't have to have it, because once the cilia are restored by the hydropulse, they're normal, and they don't need to be more normal.
Terrific. So using the hydropulse, which there's more information about that on the website. If you go onto Dr. Grossan's website, www.grossaninstitute.com. And Grossan is spelled Grossan, www.grossaninstitute.com. You can get more information. And we want to also remember that we have other shows coming up. And I'd like to invite everybody to join us in the future shows, 97.5 Health Watch. I don't want to forget to give a mazel tov to the head of our organization over here, the families of Lazari and Aronov that had a baby girl. Big mazel tov to them. I don't usually do these things, but when it comes to somebody as important as Nisim Lazari, I want to give him a big mazel tov. I want to thank Dr. Grossan for joining us tonight and sharing these beautiful insights with us. And hopefully people will go on to his website. They'll purchase his book. I think it's a very worthwhile book to purchase. And those that see fit, that need the use of the irrigator, the nasal irrigator, that's there for them as well. I'd like to just, again, remind you, next week we have, it's Monday, December 12th, Ozone in Dentistry to Avoid Root Canals and Treat Sick Gums with Dr. William Dome, also from California. I think I like these California guys. Monday, January 2nd is Why the World is Fat by Dr. Barry Popkin of North Carolina, the author of a book for what we can do and what really makes a difference. And Monday, January 9th, Using Herbs to Treat GI, Stomach and Intestinal Problems by Dr. Andrew Gadert. So we have many, he's an herbalist. We have many upcoming shows. We'd like to welcome you to join us Monday nights, 8 o'clock on 97.5 Health Watch. Thank you again, Dr. Grossan.
It's been my pleasure. Good luck to everyone.
לרדיו הידברות. אתם מאזינים לרדיו הידברות 97.5 FM.